Welcome to the Natasha Halth podcast. To help keep this podcast going, please consider donating at natashahalfer.com and share this episode. To watch the video of this podcast, you can subscribe to Natasha's channel on YouTube and follow her professional page at Natasha Halfer, LCMFT, CST-S. This podcast addresses many topics around mental health and sexuality. It may not be suitable for minors. Some topics may elicit a trigger or emotional response, so please care for yourself accordingly. The views, thoughts, and opinions expressed by our guests are their own and do not necessarily reflect the views or feelings of Natasha Halfer or the Natasha Halfer podcast. We provide a platform for open and diverse discussions, and it is important to recognize that different perspectives may be shared. We encourage our listeners to engage in critical thinking and form their own opinions. The intro and outro music for these episodes is by Otter Creek. Thank you for listening.
Well, welcome everybody to another episode of the Natasha Halfer podcast. I am thrilled to have a nurse practitioner with me today. Her name is Rita Rutland, and I have gotten to know her through her practice, Restorative Health, here in Salt Lake City, Utah, in regards to some of the trainings that we've currently been going through at Symmetry Counseling with Ketamine, assisted psychotherapy, and counseling services and things of that nature. So she's been just a wonderful, fount of information and also helped us all get our prescriptions so we could do trainings and all those kinds of things. So just really helpful in this whole process. And so I wanted to kind of, invite you to the show, and you have your own interesting background. So I'd love to have you open up with kind of a little bit about yourself and what brings you to this field and your own perspective. And I know that here in this podcast, we really focus on the intersection of mental health, but also religion and sexuality. And I think that your story definitely encompasses probably most of that as well. So yeah, tell us a little bit about yourself, Rita.
Yeah, great. So I was born in Canada, and when I was 2 years old, my parents moved to Japan to open up a healthcare institute / commune for a weird little religion that I was involved in called Seventh-day Adventists, and they were referred to as self-supporting Seventh-day Adventists. And basically, they create these communities where whatever they can do within that community supports the community. And it tends to be very focused around health. The one that we went to, the property was an old abandoned sanitarium where they used to do hydrotherapy and those types of things. And so, yeah, we went off to snake-infested, bug-infested, dilapidated sanitarium halfway up a mountain with no electricity or running water. And my mom showed up there with a 2-year-old and a 4-year-old, and anyway, they created this commune, I guess. We had a bakery, we had gardens, sanitarium, obviously, where they did very natural focus on health. I was 17 years old the first time I encountered Tylenol. I thought it was a miracle drug. Thought it was the most amazing thing ever, that there was something that you could take that would make your fever and headache go away. So when people tell me that Tylenol is placebo and it doesn't do anything, I'm like, I thought it was a miracle drug when I found it. First time I took antibiotics, I was like, there's something where you don't just gotta suffer through this stuff.
Wow.
So
even though you're focused on wellness, it's pretty restrictive as to modern medicine. Is that what I'm hearing?
In that extreme side of what I was raised, they were very much about natural remedies, golden seal and charcoal and cayenne and doing hot cold therapy and poultices, and you had an eye infection, you did a poultice. You had an ear infection, you did a poultice. If your stomach was upset, you took charcoal. If you were fighting a bacteria, you did garlic and cayenne. If and that all has its place. That's the interesting thing, is as I have gotten my education in allopathic medicine, Western medicine, when I get sick, like with the flu or start to feel like I'm coming down with a cold, my go-to is hydrotherapy and echinacea, cayenne, and garlic, ginger, turmeric. It's the things that you have readily available at home that don't need a medical provider intervention, that definitely have the potential to get you feeling better by boosting your immune system. And so I do still screamed as a child, right? But I still go back to that as an adult. And anytime I start to feel run down, I sure miss the sanitariums with the hydrotherapy rooms, all the hot, cold options. Wet sheet packs for people with insomnia and anxiety. There's these, it seems like old school torture, but it is things that are readily available in your home that you can do to help support your body that, sound weird because, well, don't you have a pill for that? Kind of, but it might make you feel worse, So anyway, that was my, initial background was completely from natural remedies and holistic, and then growing up in Japan, obviously highly influenced by Eastern medicine as well. Chiropractor, cupping, heat, acupuncture, all those things that modern medicine says there's, no science behind. But and I think it's very individualized. If something makes you feel better and you don't need to pay a lot for it, it's an intervention that you can do for yourself initially, let's go there. But let's find a balance, right? Acupuncture is unlikely to cure cancer.
Yeah.
So, finding that balance, does it make sense if you have strep throat that you take antibiotics? Probably. You don't want to end up with a heart murmur. Does it make sense if you have a viral infection to tough it out and do the things that support your immune system, even though they might not feel very good to do at the time that you're doing it, but it's going to really help your body fight a virus? Probably.
Yeah.
Is there a pill that we can give you that'll suppress everything and make you feel better temporarily until the pill wears off? Yes. Tylenol, right? High fevers, dangerous. Fevers have a place. So if you can tolerate running a fever for a couple of days so that your immune system could do what it's intended to do, you're probably going to fight off a virus much better than if you just suppress it because it doesn't feel good.
Yeah. Super interesting.
That's kind of the background that I was raised with. Always knew I wanted to go into medicine, but had to find a balance with my schedule and life and what was going to make the most sense. And I took the pre-med path as far as I could, and then I had to make a choice between continuing with all of the pre-med classes or going into nursing because they did split. And I had a little girl that I wanted to be present for, and I needed to make a choice that would, make the most sense for me scheduling, and so I chose nursing because it was a step each way. Where medical school, you go to school for 10 years before you have anything that you can work with. Nursing school, you go to school for a couple of years, you get a degree, you build on that and build on that and build on that. And never ever could you have ever told me that I would be a nurse. I had no interest. I didn't think it was something that I would ever do. But my grandmother was a nurse, and she was a huge role model for me. And when I was looking at career path change, because of my own health, I asked her how she felt about nursing, and she did it for 45 years, and she's like, absolutely, do it all over again. So that's the path I took, and I am so grateful that I got steered in that way, that I was open to doing this, because healthcare approach from a nursing standpoint, we are taught to observe a patient from the minute they walk in. We're looking at their breathing, we're looking at their posture, we're looking at their skin, we're looking at the whole patient, and we're asking them, how are you feeling? Right? Medicine tends to target the one specific problem. It really kind of harsh example, and nothing against doctors, 100%. That there's really amazing doctors out there. But what I've noticed in their difference in approach for healthcare is that they target to the one thing that they're specialized in. My dad had knee surgery. He has many other health things going on that a surgery can complicate those things. And he kept ending back in the hospital. And the surgeon would come in and he would look at the knee and say, my knee is fine. Like, but it's attached to a patient, right? Your patient's not fine, but it was like over and over. And it's just kind of that example of like, I did the knee, my knee is fine. Your patient's not. And that's where, and ultimately it was a nurse that figured out what was wrong. Between me and my mom and a nurse, we figured out what was wrong and could then get the doctor to intervene for the patient, whole patient, and not just the knee. Mm-hmm. So I love that's my training, and that's my instinct, and this has been a really good career path for me. So I just kind of kept going along the ladder to where I reached the point where, at this point in Utah, nurse practitioners it's a full practice state, meaning we can function basically at pretty much the same level as a primary care physician. We don't have any restrictions on our licensing. We can admit patients, we can order, diagnose, we can prescribe any medication. There's no restriction on what medications we can prescribe. So we function pretty much at the same level as a primary care provider that's a physician or a DO.
Right.
So
Symmetry is now offering ketamine services. To find out more, go to simcounseling.com/ketamine-services.
Before we go further on that, are you comfortable sharing? So my understanding is that your family did go through a religious transition. So even though you grew up, what you're saying, self-sufficient, mm-hmm. Seventh-day Adventist, there was a shift at some point. Yeah. Can you tell us a little bit about that and what led to that in your
I think for me, I was 16, and so I'd reached a point where my brain was starting to function and think for itself, right? From a logical look at the evidence space. And when we transitioned from Japan back to North America, it turns out as a family, the way that this religion was managed in North America didn't really resonate with us. It seemed to be more about the one spiritual leader for that commune and his rules ordained by God, kind of claiming God's power in a human form. And it seemed like it became more about the rules than about being a good person, and really about the health message. And for my mom, she was a convert, and the health message is what drew her in. She had studied nutrition and occupational therapy in university, and their approach to health and the way that they approached being a missionary had called to her. And when she came back from being a missionary to here and kind of saw the more elitist and isolating rather than inviting in, and that it seemed like it was more about the rules than it was about the human, right? More kind of similar to what I'm talking about, holistic medicine, right? Like the whole person. And so they just felt like that religion and the way that it was required to participate in did not resonate with them any longer. And that's kind of where I was at. I was like, if this is what being a good person looks like, then that's not what I want. Okay. Being told that my Japanese grandma was going to go to hell because she wouldn't convert, and she's the sweetest, nicest lady that had adopted me because I didn't have a grandma. We lived across the country, across the ocean from anywhere else. And I think my brain just started not being able to, reconcile the words from the actions. Yeah. And so I think that and I was pulling away from it, and it turned out so were my parents. And surprisingly, that was actually really hard on me because I'm like, no, I'm trying to figure out who I am, right?
Steady.
You're supposed to stay, and I'm the age now that my mom was when I had my daughter. And it's interesting to think, I'm like, yeah, so, 10 years even before that, like, of course she was still trying to figure out who she was at 32 or, it's so funny how you think your parents are so grown up in their 30s, right? And that they're just going to be frozen in time. And I think that also was really healthy for me because it helped me understand that we are constantly changing and constantly growing, and that we get to change our minds. We get to change our belief structure. And when somebody says, well, you said, or this you did, or you believed, or you committed to, and it's like, yes, and then we changed, and that's okay. And in my own practice, I really support that with my patients, that you do get to change. You in any direction, right? And I'm here to hopefully facilitate you changing in a direction that takes your life in a direction that you're wanting it to go. That, helps you with functionality and integration rather than isolation or separation.
Yeah.
We we definitely got a lot of flack from it, but we just kind of went back to Japan and did our own thing. And so we also didn't have to deal too much with the rift, the cultural divide, because my dad was kind of one of the leaders too. And so, but it is interesting to come back or talk to friends in the community and hear the stories that were being told. Because churches, they're not kind about people changing their mind or moving on to something different. So,
Yeah.
but so yeah, living in Utah, like I see that transition. I was lucky that I didn't have to lose my community and my parents at the same time to make that shift.
Yeah.
Because we made that shift together, but on our own at the same time,
Was there any disillusionment from, like, especially your mother? You're saying, she converted really to this faith from a wellness and health perspective. Was there any disillusionment to the strictness of that or the limitations that the religion placed on?
She, I think, became a little bit more practical in her health and less restrictive, more open to Western medicine, a little more open with diet, those types of things. But in general, she still like really stayed healthy. And I think their health message is very healthy. And there's a Netflix show about longevity. You are what you eat, or something like that, I think it's called.
Okay.
And it each episode goes over different places in the world that have the highest number of centennials. And one of the places is Loma Linda in California. And that's a Seventh-day Adventist city, because it's built around Loma Linda University. Ben Carson, Gifted Hands, I think he was part of Trump's crew, assigned to something, I can't remember, but he was a very, very gifted neurosurgeon, and I believe he functioned there. He was Seventh-day Adventist. The first heart transplant that was done with a baboon to a baby, that was Loma Linda University. So they're a pretty prestigious medical hospital where they do a lot of research.
Okay.
So that town is one of the healthiest in the world. Okinawa, Japan, where I also was, is at the very number one. But it was interesting to hear them talk about the reasons why people are healthy there and live so long, and a huge part of it is diet and community, and avoiding isolation, and physical activity, and having something that is a purpose. almost everybody has a little garden, even if it's just a few pots out front, where they are tending something and working in the soil, which gives me the heebie-jeebies. I can't stand to have dirt on my hands. I want nothing to do with it. My mom loves the garden. She grows the food. I cook it. Please don't ask me to get dirt on my hands, but I do see that benefit. And when you're gardening, you're squatting and you're doing a lot of movements where you're squatting down and holding your balance and getting back up, and squatting down and holding your balance and getting back up. And that can play a big role in your physical health because you're using those accessory muscles. So it was interesting to watch that. Like, I'm like, that's my culture, because I identified as Japanese unless I looked in the mirror for my entire childhood. And then, Loma Linda University being listed as, one of the healthiest cities in the world, right?
Yeah.
And part of that is their focus on health and diet and community. So I see. Go ahead.
Oh yeah, I was just saying, how did you end up in Utah? And then
Right.
and then seeing, maybe because this is a predominantly Latter-day Saint,
Yeah.
state. And
Yeah.
did you see like similarities or differences, or
So yeah, so to get super personal, I left an abusive relationship and found that I was pregnant after I left. And so I was having a baby, and the economy was tanking in Japan, and my parents were kind of looking for a shift. My mom's like, I'm not doing the same thing that I did with my parents. Like, I'm growing up with my grandchild is growing up with me, so I'm going with her wherever she is. My parents have a great relationship. They're one of the few people out there that have been married for over 50 years and still like each other. And and the economy was tanking. My brother had married a girl from Utah, and both my dad and my brother are carpenters, and so my brother was like, why don't you come here? And my dad was like, you don't need to have a child on your own, come with us. So that's how we all ended up in Utah. My dad's actually American, but moved to Canada when he was a teenager, and then my mom's Canadian. So yeah, that's how we ended up in Utah. And I needed a student visa until I could get in, on a green card. So I needed to go to school, and I got a degree in sports medicine. So that's where I first started, was a degree in sports medicine, and I worked as a personal trainer for years. And that's how I put myself through nursing school. So coming to Utah, it did not, aside the fact that I moved from Japan to America, right? And that culture shock. The religious aspect of it was not as unnerving or problematic for me as it seemed to be for a lot of other people, especially for people that live in Utah, because no matter where I lived somewhere where there was a predominant religion. So in Japan, obviously religion and culture can't be separated at all. Government, religion, it's all Shinto, Buddha, heavy. It's just part of it, right? I lived in Ontario for 2 years, where it's predominantly Catholic, to the point that there's different taxes, so, and yes, the liquor store is closed on Sunday, and there are many other things are closed on Sunday, and there's many things you can't do on Sunday. Everything's closed on Sunday in Japan. I don't know that it has anything to do with religion. That's just their day off. Oftentimes it's Sunday, Monday that the places would be closed. We were always closed on Saturday because that's when we went to church, and Saturday are big business days. So they were always like, how are you closed on a Saturday? But almost everything was closed on Sunday. So coming to Utah and having a predominant religion and having liquor stores closed, or, things closed on Sunday, or different rules, then I was just kind of like, okay, so that's what we do at this state. It didn't I didn't even occur to me to grumble about, well, Utah, So, and I found a lot of similarities, and I think there's aspects about the Mormon religion where they are so family centered and welcoming. There were parts of it that I think were also welcoming and inclusive, right? Until I didn't agree to sign up. you know, and then much like many religions, it becomes exclusive. But uh, I've always been open to hearing about other people's religious beliefs, and as long as they don't expect me to, subscribe as well. And my thing has just been like no to organized religion. I don't care if it's pagan or shaman or Eastern or Christian. I you need to do what makes the most sense for you and whatever makes you a better person. And if in the process of telling me what to do, you're behaving like a not cool person, I don't like it.
Yeah.
Yeah.
I put that.
I definitely, I had my first baby at 21, and I had a lot of people ask me where my other ones were.
Okay. Yeah.
And I'm like, wait, what? I feel young to be having one at all.
Right. Yeah.
And obviously, there was some judgment from being a single mom. Like everybody was happy to talk to me until they found out that there was no dad in the picture and that I wasn't married and I wasn't having more, and those types of things. But the culture in Utah, I think, has not gotten under my skin as much as a lot of Utah residents.
Okay.
Which, having grown up in very, very strict religious commune type situation, I think it felt much more free compared to where I had been, And I've lived in many states and countries, and so I understood that. My dad's from the South. His father's side is from the South, and you want to talk about religion down there. There's dry counties. When people complain about Utah liquor laws, I'm like, but you get to have it. Like, it can be worse. Right? So, yeah.
I love having
a long ramble to your questions.
No, I love it. And I think it's so important because, I think a large part of my audience is probably, LDS adjacent in some way. And so I think it is good to really hear other people's perspectives, different people who've traveled or been part of other religious communities, and kind of put both of our positives and our negatives in perspective with other communities. So I think that's great. It sounds like when you started going into nursing and started even your practice, that one of your first things that you were interested in was chronic pain. Am I understanding that correctly? And can you maybe start going down
that pathway? Yeah.
For you?
Mm-hmm. Yeah. So I got diagnosed with fibromyalgia when I was 23. I was a personal trainer. I was running 6 days a week. I was lifting 4 days a week. I lived in the gym. I went out dancing probably 4 nights a week. I hiked. I was very active. And I woke up one morning and I couldn't move. And every movement I made was excruciating and made no sense. Nothing about my life had changed. And I got scared. I thought I was going to end up in a wheelchair, and being active was my life, I remember thinking, like, was that the last time I went to a dance club? Is that the last time, like, I'm going to be dancing? Like, that was my therapy, to just go dance. Me and my best friend would find a corner up high. We'd find a bouncer to keep everybody away from us, and we would just dance for like 5 hours straight. So yeah, much more fit back then. I was, 22, 23, right? And it was scary. It was really scary for me. I thought I was going to end up in a wheelchair. I didn't know what to do. I'd barely gotten health insurance. And so, I promptly went and saw a doctor, and we did all the blood work to rule out all the things.
Mm-hmm.
And this is something I run into all the time with medicine, and that I kind of had a similar idea, like, you're the doctor, tell me what's wrong. And what we can do is we can rule out all the scary things, right? We can look for all the things that we can say, aha, this was positive, this is what you have, right?
Right.
But almost always the story is, we've done all the tests, we can't find anything wrong with you. Right? Luckily, I had a younger doctor, and this was back when fibromyalgia was just barely getting recognized. And he, ran through the tests that they do for fibromyalgia, which is a syndrome, meaning it's a collection of symptoms that match repeatedly enough that we've given it a name.
Mm-hmm.
Right? And so you have fibromyalgia. What does that mean? It means that you don't have any of the scary things. It's not going to kill you. Okay, now what? Oh, we don't have a now what.
Mm.
Good luck. Would you like to see a pain specialist?
Mm.
Well, yeah, okay, let's go see a rheumatologist, like do something, and went and saw that rheumatologist, and here's some opioids. Well, I knew enough that I knew I didn't want those,
Mm.
so then I was like, okay, I'm taking this into my own hands. Let's figure out. When I got over the fear, right? The fear of, because I knew about like rheumatoid arthritis and lupus and other joint and pain conditions that were deteriorating conditions that eventually you were going to end up in a wheelchair and eventually you're going to get pneumonia because you can't breathe. Those things were gone. So when the fear went away, the pain subsided enough and my brain could work. Because when you're in a fear state, you can't think, right? When you're anxious, there's no logic. You gotta be able to breathe in order for your brain to work, And so when that,
Stop you right there. So
yeah,
you're saying, I would second as a mental health practitioner, is that anxiety can exacerbate how you experience pain in your body.
dramatically. Yeah. The more anxious you get, the worse the pain gets. The worse the pain gets, the more anxious you get. It escalates, it escalates, it escalates, and you burn through all of your body's resources before you have a solution to anything.
Yeah.
Yeah. Yeah. So, took matters into my own hands, started researching what is this fibromyalgia. There was a few books. Nobody really knew anything. The specialists certainly were not helpful. They're like, oh, well, exercise. Well, I'm like, I've been exercising. Normally it's lose weight. I'm like, my BMI is 16. We don't need to lose weight. Don't drink. I didn't drink back then. Restrictive diet, cut out red meat. I was vegetarian. All these things that they're just, I'm like, I already do all those things, and this like hit me like a freight train. So yeah, I just started regular medicine, allopathic medicine, Western medicine, whatever you want to call it, couldn't help me, and so I started reaching out to holistic providers and alternative therapy, and ran the gauntlet of supplements and interventions and IVs and whatever that could help me, and also eventually came to terms that this is my life. And so I need to figure out how to still make life work for me.
Mm.
That when people with a medical condition reach a point of resignation, that this is my life and this is what I can work with, they have a choice. And you see there's two different kinds of people most of the time. The kind that sit on the couch and give up, and the kind that just figure out how to work with it. And luckily, between my upbringing and genetics and however my brain works, I chose, all right, so what can I do with this? Obviously, I had to change careers. I couldn't work out anymore, and so that's where the nursing came into place. So fast forward 20 years with this, having tried random things here and there. I had a naturopathic doctor that told me, you need to do ketamine. And I thought he was crazy. I had experienced ketamine without consent at a club once. Somebody had dosed me with it.
Wow.
And I couldn't fathom how that could possibly be therapeutic for anything.
Yeah.
And so I was very, very, very resistant to even hearing about it or considering it. I just thought he was nuts. But over time, I like, all right, fine, tell me about this, And this is when I was in grad school for completing my practitioner degree. And the clinic that he was at, I think it was $750 to do a treatment. So it certainly was, as a single mom of 2 kids in grad school, it was not somewhere I could be spending my money, especially on a complete gamble, because it's a complete gamble. It's like, it's worth a try. There's no guarantee, right?
Yeah.
So it wasn't until I finished grad school, it was after about a year of him every now and then, when I'm just like, I can't, there's got to be something, like I can't just keep going like this, especially with the stress of grad school. And he'd be like, ketamine, and I'm like, nope. Like, okay. Then I talk to him and they'd be like, gonna think about ketamine yet? I'm like, nope. And then I finally like agreed to do a treatment, and it made me so anxious, and I've panicked so much that he was like, it's okay, you're not ready, some other time. So it was a full year of coaxing. I finally agreed to do a treatment, and I got my life back. Like, it was subtle, it wasn't an overnight thing, but I started dating somebody that was very active, and they were not part of my community. They didn't know my story. And he would invite me to go to the gym or invite me to go on a hike. And I'd be like, okay, I'll come hang out with you, but I can't lift. Once I was at the gym, I missed working out so much, that I started like doing stuff. And he's like, that's it. And I'm like, oh yeah, if I do anything, like I won't be able to get out of bed for the next 4 days. But then I would, and it wouldn't put me in bed. And then I'd go on a hike, and it wouldn't put me in bed. And I would do some lunges, and it wouldn't put me in bed. And so I just tentatively started, moving more with that, and like a game changer. I got my life back. I work out 6 days a week. I can hike. I can ski, and be fine the next day. I can paddleboard. I can do leg day and go climb Bell's Canyon. And I get normal muscle soreness that you would expect. And so once I was a provider and learned more about how to access ketamine and how to administer it, I was like, you got to train me. This is like, everybody needs to be able to have this. Like, anybody with fibromyalgia needs to be able to have this. And then
Can you explain a little bit of how you would explain maybe the science behind that, or how, what is it about ketamine that is helping?
Right? What is it? Yeah. So, I got into ketamine for pain management. That being said, most of the studies for ketamine have been around mood. Ketamine is a anesthesia. It's an old drug. It's been around since, I think it first came out in 1959. And it was, and so it is a generic drug that has been around for a long time. And so its safety profile is very, 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 very well established. Ketamine is what scientists refer to as a dirty drug or a sticky drug. They can't narrow it down. They can't target ketamine does this. Most medications, they can target one receptor site or one neurotransmitter. They can explain, you do this, this happens. They can't explain that with ketamine, but they have like a bigger picture of it. And I can give you kind of a Reader's Digest, non-medical version of it.
I would love
that. Ketamine binds to your neuroconnecting sites. Your nerves have little fingers, and the signal comes down the nerve to these endings. A neurotransmitter connects between that space and allows the signal to go onto this nerve, and then it travels down that way. Ketamine binds to the connecting sites, and depending on what that site is, it can stimulate it or it can quiet it. It stimulates neural regrowth and new growth. It takes these little connecting sites that have shriveled, either through damage or lack of use, and regrows them bigger, bolder, stronger. It also makes new connections. Little buds form off of these connecting sites to make a new connection option. Those new connections on the psychiatric side of things, that's what allows you to shift your relationship with whatever isn't working for you. Make new habits, new processes, new connections that take your life in a direction that you want it to go. Regrowth of those neural connecting sites gets you back to who you are. When people have chronic conditions and mood disorders, personality disorders, anything on the psychiatric side where mental health isn't working. That new growth is really what's so useful, but that regrowing old connections is what gets you back to being you. It's such a common thread in anybody with chronic health conditions, mental or physical, is this isn't me. I didn't used to be like this, right?
Yeah.
Regrowing those connecting sites gets you back to being you. And so those changes are often subtle, and you tend to not notice that shift in yourself nearly as much as people around you because you start being you, and so it feels very natural. You're just back to doing everything that like was normal for you before, you know. And for me, from a pain perspective, that's kind of what happened with me. It wasn't like, oh, and I'm pain free. It was that I could do things and my brain was clearer and I could think and I could just I was more me. My brain was firing at a level that it used to fire at. I was being able to be physically active at the level that I used to. I could sleep. So then I had coping skills again because I was getting rest and I wasn't using everything up on pain. Ketamine's really great for neuropathic pain, meaning pain that comes from nerves going rogue or nerve damage. Fibromyalgia is rogue nerve pain firing. Your pain signals are sending signals to your brain when they don't need to. Example, if anybody's ever had a wound that maybe has gotten infected or some kind of injury that they couldn't get care for immediately, you got a knife in your arm, instant pain, sharp, boom, it's right here, right? But if you don't get that knife out or it gets a little bit infected, the pain starts to radiate out, right? Now my elbow hurts, my wrist hurts, even my shoulder hurts, and then I don't know over here. Like they don't even know, right? Get the knife out, get it cleaned up, get it stitched. These pain fibers stop. It's healed and everything's fine. These guys didn't get the memo. They didn't get the memo that everything's okay now and they can shush. Right? They're still trying to get your brain's attention that something's wrong. They didn't get the memo that it's okay. And that's kind of what happens with fibromyalgia. They call it C fiber type pain. And so they're the joiner inners of the pain signal. They're like, hey guys, we're sending a pain signal. 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 If you have if you've had a back injury, you on a good day, you can put your finger right on the place that hurts. On a bad day, 2 hands aren't going to cover the area that hurts.
Yeah.
Kind of concept, right? They're those joiner inners. It's just everything's escalating because it's so tense and mad.
Yeah.
And so that's fibromyalgia. So ketamine binds to those pain signals and closes them. So it decreases the number of pain fibers participating in the pain signal. So you can bring it down to just that spot.
Yeah.
So that's how it helps with pain, and with fibro, it's that just quieting that whole system down so that now the rest of your body can calm down and allow for healing, allow for sleep, allow for the things that like let you heal and rejuvenate and cope with life.
I love that. And I think it's important for people to know too, like, you mentioned the knife, that's like a physical wound. But again, we know that trauma, so through like the ACE study, the adverse childhood effects study, they really made this connection more than ever. I mean, I think we kind of knew this ahead of the ACE study, but that trauma is an experience that then opens up kind of these pain receptors. It's kind of like a gate theory type pain, and which can make pain either creates pain or it makes whatever pain you're experiencing worse through trauma. And so that's why, you see so much of this also being helpful for people who have depression, who have sexual trauma, who have religious trauma, who have, intergenerational trauma, right? Is that we are experiencing not just a mental thing, but something that's affecting our actual bodies and those neurons that are firing and trying to alert our body that there's something wrong when maybe it's not a knife. Right. It's more like all this stuff you've experienced in your past.
No, I see that a lot. And on the psych side of things, ketamine is a dissociative anesthesia. So the way that it works is it blocks the communication between your body and your brain's interpretation center. So while the medication is in your system, your brain is getting decreased input from your body and the outside world. It's not used to that. Without that input, it's got to figure out life on its own, wanders off on an adventure. That journey that your mind goes on can be anywhere from terrifying to epically beautiful. Most people land in the realm of, this is weird. And that's okay. And it doesn't matter where your mind goes in that spectrum. If ketamine is going to help you, it is going to help you. But there can be some things that can really help it be more therapeutic. Ketamine is a really, really useful tool. That detachment that it gives from your body and the way that it works as an anesthesia, it also allows you to detach from the emotional and physical response to trauma and triggers that make you block and shut down. Right? Your cells think it's happening right now. I'm going to die. This is happening again. Ketamine lets you move away from that and get distance from it. So it's not happening to you right now. And you can get your cells to understand it's not happening right now. And the likelihood of it happening again is really low. And you're going to survive it. You already survived it, right? Now you can close that chapter. We're not trying to pretend it didn't happen. We're not trying to make it go away. We're not trying to be okay with it, but it might benefit your life if you can close the chapter on it so that you're not bringing it into every chapter of your life. Mm-hmm. Something happened to you at 5, it's interruptive to have that emotion, that trauma, that triggered space show up when you're 25, show up when you're 50, show up, right?
Yes.
And so ketamine, because it allows that detachment, it allows you to see that it's not happening right now. Mm-hmm. And it allows you to see your way through it and come out on the other side and know that you're okay. And so get your cells to understand at a cellular level that you're safe and you're whole and you can heal and you're going to be okay. Yeah. And so ketamine is a really, really, really useful tool with trauma. It's not going to make you relive something. It's not going to take you somewhere that you don't want to be. It's not a truth serum, but it can, if you want that to happen, it can help facilitate that from a detached space so that you're able to talk about something without shutting down, without blocking, to see that it happened and that you weren't responsible for it. You're not, children that get raped, right? Like the story is that they're bad, that they did something to deserve that. And they take that over and over into a relationship, right? And it's so hard to have a healthy sexual relationship when you're carrying that. And so to be able to see that it wasn't your fault, or if there was some aspect about something that happened within trauma that was, to be able to forgive yourself. Mm-hmm. Mm-hmm. That you know better now, or however that works. And so ketamine just is really, really useful for clarity in those types of situations. So that's where the ketamine-assisted psychotherapy comes into place. I think really around trauma, anxiety, those types of things. On the depression side of things, what ketamine does is regrow those neural connecting sites. Depression happens because you don't have enough neurotransmitters. At least this is our current understanding. You either don't have enough neurotransmitters or you can't use them. Mm-hmm. If you ask somebody why they don't have enough neurotransmitters or really why depression happens, I bet you about 70% are going to answer unresolved trauma if that's given as an option. Mm-hmm. It's much less likely that it's generational and genetic. But that does happen. For one reason or another, you don't have enough neurotransmitters, either because you don't make enough, you can't use them, or you've burned through all of your resources living in a constant state of fight or flight. Yeah. Because of chronic illness, unresolved trauma, high-stress jobs, being a caretaker of somebody that's chronically ill, whatever it is that's just kept you in a constant fight or flight. Eventually, you run out. And then you have no coping skills left and no resources left. And then you're just running on empty for as long as you can, and you got nothing to handle any kind of side hit, right?
Yeah.
In order for nerves to talk to each other, you got to have those neurotransmitters. They bridge that gap. They allow signals to pass from one to another. Without neurotransmitters, this is not being used. It starts to shrivel. Now you have a very large gap. This is usually when people go see a doctor. They get put on medications that boost neurotransmitters, like SSRIs, right? Lexapro, Celexa, Prozac, Wellbutrin, that's more well-rounded. Great. Now you got all these neurotransmitters boosted, floating around in your bloodstream, giving you all the nasty side effects and none of the benefits. You can't use them. Gap's too wide. Can't bridge that gap. So ketamine regrows that connecting site. Bigger, bolder, stronger. Now you can use them.
Which is what something that you told me when I went in to talk to you about this, is that you're saying that you can see increase of effectiveness of antidepressants and anti-anxiety pills when people are using ketamine.
Correct. They have very little chance of working beforehand, but they sure have a chance of working afterwards. And that is showing in the studies when they look at drug-drug interactions, is that any of the medications that are serotonergic pathways, norepinephrine, and dopamine, GABA, these types of things, right? But especially with serotonin, that if you keep your serotonin drugs at the level that they were pre-ketamine, you can actually go into serotonin syndrome, which means too much serotonin. And so what I've found is some patients, for one reason or another, either because they just have genetic depression. I've been depressed since I was 12. Nothing bad happened to me. I was loved. There was no trauma. I just started becoming apathetic and sad and forgot that I ever liked anything, right? That does happen. There's plenty of that, and my mom and my sister and my brother were all this way, and they all take this medication. But what I found is, and so they've done ketamine and they feel a lot better. They're clearer, brighter, things are working, but then they're like kind of petering off again for no reason. Not because something bad is happening or because they're ill or because they're burning through stuff, right? They just don't make enough. And so putting them on a low dose of a medication that kind of was working before, like Lexapro, for example, it usually starts at 5, 10, and 20 milligrams. This is a serotonin reuptake inhibitor. Maybe they were on 20 milligrams and feeling hardly anything and just kind of gave up, quit it, right? They do ketamine, we put them on 5 milligrams of it. They're having way more benefit than they ever experienced with 20 milligrams because it's enough. They can use it. It's a low dose of something. They're not getting the side effects because they're using it, right? Because side effects happen a lot of the times because it's just floating around, not doing its job, right? It can't be stored. It can't be used. It's just there getting in the way of everything else. It's like, well, okay, yeah, we'll use that. Well, now I'm sick, or I feel zappy. What I found is a low dose of a mood stabilizer or an antidepressant afterwards, it has a chance of working, and when people come in and say, no, nothing works, none of those antidepressants, there's no point in me being on antidepressants. I understand why you think that, and I'm not going to fight you on it. But if you do ketamine and you're willing to try a low dose of something that you didn't have bad side effects to, we're gonna give that a try. And there's a decent probability that it's actually going to work this time.
Yeah, that's fascinating. One question I had for you, a lot of people that I work with, especially post-religious folks, tend to be very interested in psychedelic experiences. Some of the things that you hear a lot these days is psilocybin, MDMA. And I think sometimes like they think those things will be better than ketamine because maybe they're natural, they're plant medicine versus ketamine. You kind of schooled me on that a little bit. So I'd love to give you an opportunity.
Okay.
Just to be clear too, like psilocybin and MDMA are not legal in any state I'm aware of currently. Well, except for Oregon, but again, kind of very clinically. So.
As far as somebody going and purchasing it and saying I'm going to do MDMA, correct. They aren't. They've been decriminalized in some places and legalized in other places. And the difference between decriminalized and legalized is like legalized is actually way more complex. It's more problematic to be legalized because then the government has to get involved. They have to have a program. They have to have how do people access this? Who's allowed to administer it? Who supervises it on what dose? But that helps safety, right? Decriminalizing it means you can access it if you find somewhere to get it, and you're not going to go to jail for it. Yeah. That's kind of the difference between decriminalizing something and legalizing something. Utah actually passed to study psilocybin and MDMA, and they are in study phases. Yes. University of Utah healthcare system and IHC healthcare system are the only ones that can be involved in that because of the way that it was written. They excluded all the little people. But it is currently being studied, and which is what I'm waiting for. I'm waiting for those studies that tell me who is this safe for and who is it not. What medications are okay to have with it and what are not, because that's what's not out there right now.
Yeah.
And as a medical provider who's putting their license on the line, I need to know those things. Plant medicine, by its fans and followers, is oftentimes approached as it's plant medicine, it's safe. It's natural, it's safe. Just think about that for a second. How many deadly poisons are natural? So natural doesn't make it safe.
I agree. I think like is it petroleum natural? Like, doesn't it come out of the ground?
But so like whenever somebody tells me that it's gentle and it's safe, I have a difficult time continuing to have a conversation with them from a medicine perspective. And honestly, particularly listening, because our goals and abilities don't match, right? Because I can recognize that there are poisonous plants. There are poisonous things out there. And many things have a lethal dose. At a small dose, it's okay, but and I think the confusion is that there is unlikely to be a lethal dose of psilocybin unless there's something wrong with you physically, right? Unless you already have too much serotonin in your body and you're already super anxious, right? If you're anxious, it's unlikely that you're short on serotonin. And so if you take something that then dumps serotonin into your bloodstream, you end up with serotonin syndrome, which can be fatal, can be very dangerous. People end up in the hospital for it. And I think it's really important to understand the basic chemical makeup of things, as well as the human body, if you're going to be recommending to someone to do these things. Yes. The thing about ketamine is its safety is so well established. It is primarily used in babies, children, small children, and animals because of its safety profile. We can't say that about MDMA and psilocybin. As it used as a party drug, there are a ton of, rogue 13-year-olds showing up to raves with fake IDs back in the 90s, taking this medication, and occasionally one or two of them ending up in the hospital. Yes. If you're comparing it to an opioid, absolutely. Its lethal dose is very huge, right? Same with ketamine. Ketamine's lethal dose is, I believe, almost 3,000 milligrams given all at once straight into your vein, right? Have there been some people that have had deaths with ketamine being brought up as association with it? Yes. There was an ambulance case out in Colorado where they were, the person was given 750 milligrams and turns out had a genetic heart condition that couldn't tolerate the increase in heart rate and blood pressure. And so he died from cardiac arrest because his heart wasn't safe for that medication. Yeah. Not because the medication wasn't safe, right? Yeah. We have the Matthew Perry, is that his name?
Yeah.
All of a sudden, bad rap for ketamine all of a sudden.
Yeah.
The number one headline, ketamine. He had opioids, alcohol, and ketamine in his system. Alcohol and ketamine should never be combined. Opioids and alcohol should never be combined. Opioids and ketamine should be very carefully combined under medical supervision. Hot tub and ketamine shouldn't be combined. Coronary artery disease and hot tub shouldn't be combined. Coronary artery disease and alcohol shouldn't be combined, right? But we're giving ketamine the attention.
Yes.
And it wasn't administered legally, it wasn't accessed legally, it wasn't utilized legally, right? Unlikely. We don't know. But the ketamine that was in his system, it's unlikely that the dose that was in his system was a prescription dose. If that makes sense, right?
Yeah.
And people, have been asking me like, how has that affected your ketamine clinic? And I want to go, I don't know, has it affected hot tub sales?
Yeah.
Has it affected alcohol sales?
Yeah.
Because when you don't use things safely, you end up with problems. So the thing about ketamine is we know what the safe dose is. We know what medications it can and cannot be combined with. We know what physical conditions exclude you from being safe for you to use ketamine. And at our clinic, we always do consultations and screen you for all of those. We want to know about all your medical medications. We want to know about all of your physical conditions. And we want to coordinate with your healthcare providers. And if you have something that is of concern, we're going to send you to a specialist to get cleared for it. I know that there's ketamine clinics out there that don't do that. I recommend if you're seeking ketamine treatment, make sure that it's somewhere that does a medical clearance for it. Yes, it is a very safe anesthesia. It is something that we can use out in the mountains to set a bone. But when you're seeking treatment, we want to make sure if we have the opportunity to screen you, we should do that.
Right.
Back to your question about plant medicine and safety, and that feels better. They all have their place. And I think they are all safe within reason, right? But if you're going to do something that can't be prescribed by a medical provider and can't be cleared, because we lose our DEA licenses if we recommend using a Schedule 1 or illegal substance. And that comes back and it's in writing or whatever, right? So we're very cautious about this. But I definitely approach psilocybin with harm reduction. And and that is my cautionary tale to you, right? Make sure that, can you handle high doses of serotonin? Would that be appropriate for you? Can you handle a dramatic increase in blood pressure and heart rate? Where are you at mentally? Do you have a history of psychosis? Do you have bipolar, schizophrenia, hearing voices, hallucinations, delusions, psychiatric conditions that haven't been diagnosed? Psilocybin may not be your best choice. And it is probably worth having a conversation with a medical provider that at least is aware of how it works. I've had 3 different people end up in the hospital, 2 that have never recovered from psilocybin-induced psychosis. Does that scare me? Yes. Does that mean that I throw it all away and say psilocybin is bad? No. I think it has a place. And I look forward to the studies. And I think for people that have lived very restrictive lives and lives where they've always been told what they can and cannot do, doing something like that puts you in a space where you have no control and it kind of opens things up for you. I think there's therapeutic benefit to that. But it's not a cure for everyone. It's not the right thing for everyone. MDMA, you as a sex therapist, I think MDMA is probably, based on my understanding of it, probably one of the best medications to help somebody connect physically and feel safe with physical touch. I think it's going to be a really useful sex therapy medication. It has a misconception of being a sex drug, right? Because it's such a tactile. When people watch people on Molly, right? They see touchy-feely, and at least as a Western society, but I think kind of it's predominant in many places that if you're touching, you're going to have sex. And I think, and that oftentimes my observation has been, it doesn't occur to you. Sex actually doesn't occur to you. And a lot of people, especially males, are not capable of having sex on this medication because of its serotonin dump, right? But I think it's something that's going to allow people to experience physical touch safely. And so that they can start to associate physical touch as not something that's scary, not something to flinch away from, and not something that has to be associated with sex.
Yeah.
So I think MDMA is going to be amazing resource for sex trauma therapy.
Yeah, no, I too, like you, I'm looking forward to all the studies and the trainings and the things so that hopefully we can use these medicines in ways that can be very beneficial. So, and I think one of the things too about ketamine, quite frankly, that's just more accessible is that it doesn't stay in your system as long, right?
Yeah. If you're looking at LSD or MDMA or psilocybin, you're looking anywhere from a 4, 6, 8, 12-hour commitment, right?
Yeah.
Half-life is 15 minutes, meaning the amount of time it takes for half the medication to clear your system is 15 minutes. So most people are back to normal within about 2.5 to 4 hours. And again, I've seen it with couples over and over, and obviously scientifically I can't explain it, but when couples do ketamine treatments together and they hold hands, they go to the same place. Oftentimes they wake up and they can exchange stories and they were in the same place. And you are, even though you become less aware of your body, you become very aware of energy and connection. And I think that can be really useful. And the detachment that it gives you, I think can be very useful in having difficult conversations where you are inhibited from saying things that do need to be said. And because you're detached from it, you're not having a conversation with having a difficult conversation with your partner from a emotional volatile space, and you're able to have more matter-of-fact conversations that are less accusatory, less painful, less loaded, right? Less loaded words and more useful words. Words that really actually convey the message that you're wanting to convey. And they're able to receive it as well from a more detached space and not as a trigger. So I think
we're just starting to experiment with this at Symmetry Counseling. We're so excited to see the effects, and already have seen just with a few clients, some really tremendous just ways of showing up differently. People I've worked with for years, and now all of a sudden I'm like, wow, you really showed up in a different way, in our session, and that's really exciting. Can you talk a little bit about, so like if they come in for a ketamine kind of treatment approach, what are the different options? What's the commitment? Typically it seems like 6 sessions is
the original studies were 6 sessions. The original studies were like 0.5 milligram per kilogram over 40 minutes. And the evidence isn't great for longevity of those doses and amount. And so in 2020, the American Psychiatric Association came out with, in 2021, they released 2020 consensus guidelines, and they basically came out with a range of 0.7 milligram to 1.5 milligram per kilogram, which was interesting because I was already doing that. So it was fun to have you're doing it right range, right? Because I knew that those lower doses, we weren't seeing the same results. And then they came out for depression and suicidal ideation that they're actually seeing more the 6 to 10 range. So giving that a little more each person is different, which is my approach to healthcare. I'm not locking you in a box. You don't have to commit to 6 treatments. You might need more. We're going to work with you. Let's first see how this medication feels in your body. The nice thing about those consensus guidelines is they gave us a starting point and flexibility. And so we got to start you somewhere. So this is where we start you at 0.7 milligram per kilogram of ideal body weight. If your BMI is higher than 30. And that gives us a starting point. And then we go up or down from there based on how was the treatment experience and what are you noticing in the days following. There was a misconception that dissociation was why ketamine worked. It is not, but there is benefit in it. So we don't chase it, but we don't prevent it either. Some people, they're not ready for that dissociative state. That's too scary for them, and it's going to scare them away from something that might work for them. So do we need to do a little bit gentler approach to this? So I am very, very, very individualized in my approach to each patient. And when they do consultations with me based on what they're sharing, I might adjust even the starting dose or how fast we administer, and because there's different ways of administering ketamine that's going to work better for one person versus another. We can administer it very fast. We can administer it very slow. We can go higher doses. We can go lower doses. But in general, we start people off on a standard protocol and then make adjustments from there. They did come out, like for depression, it's more like 6 to 10 with severe suicidal ideation. Ketamine has an amazing ability to just abort suicidal ideation. Just boom. And so obviously I want you safe. If you're not safe, please go to the ER. But if it's like I can hold out and I want to try something, doing a ketamine treatment is probably the fastest way that we're going to be able to reset you over anything else that's available out there right now. And more emergency rooms and inpatient psych are starting to utilize ketamine because of that, because it just stops suicidal ideation for people that respond to it. There's always going to be people that don't. But yeah, if you come in, you're going to do a consultation. We're going to go over why you're doing these treatments. If pain, if so, what type of pain? Anxiety, PTSD, depression, bipolar, eating disorder, addiction. It can work for all of those things. Amazing for addiction of any form, because it makes those new pathways so you can change your relationship with it, right? If you're talking PTSD, maybe you're going to do a session, meet up with your therapist, work on some things, come back in, peel away another layer, work on some things, come back in, But everybody, I think, that's had something chronic going on, they've got depression, meaning things aren't connecting. They're in a brain fog, they're apathetic, they don't care, they're sad, they don't feel happy. But we find out what your goals are, what you're hoping to accomplish, what your intentions are, and really try to tailor the treatment and frequency to that. But standard recommendation is probably 2 treatments a week for the first 2 weeks, and then one treatment, and then let's see how you're doing. But I usually encourage people to do at least 3 treatments within 10 to 14 days if they can. Oftentimes that first treatment, you get that kind of reboot, reset aspect of it, but you didn't get here overnight. It's not going to fix overnight. But this is the fastest thing we've got out there. But let's still be realistic and give it some time, So usually by the 3rd or 4th treatment is where people are starting to notice a difference in their ability to cope and their ability to function. Severe depression. I mean, I've had people come in and say, I brushed my teeth 5 days in a row. That's a big step.
Yeah.
I got out of bed. I showed up to work every day today. I didn't have to leave. I had a panic attack and I went outside and I walked around the building, but I was able to come back in and finish my shift. These are the subtle shifts that we're looking for to help you be functional in your life. Find moments of joy. Happy all the time is not a realistic goal. That's a medical condition too. Contentment, right?
Yeah.
Contentment, or this feeling of I've got this, and really like your cells resonating and believing that. When it comes to anxiety and panic disorder, anxiety comes from a space of we can only see one way. It has to be this way, but we can't see how to make it happen.
Yeah.
Ketamine takes you from the dark forest and the narrow path and the boulder in front and the scary sounds before, and you're just frozen, right? It lifts you out into the meadow. And you can see that there's multiple pathways through the forest. It doesn't really matter which one you take. You're going to get through it. And so it takes that anxiety just down from the space of like all the what ifs to, okay, if that happens, then we'll handle it.
Yeah.
Okay, we'll handle it. And I can speak to that for myself because I lived at an anxiety 7 out of 10 all the time. That was just normal life. I didn't even think I felt anxious when I was a 7 out of 10. That was just normal. At 9 out of 10, I felt a little uncomfortable. At 12 out of 10, I'm like, I need something, and doing ketamine for pain, the added benefit was my anxiety lives at a 0 to 1 out of 10. If I'm feeling anxious, there's probably something wrong that I need to pay attention to. Anxiety has its place. You need anxiety, but you don't need to be in anxiety 24/7. And so depending on what you're treating, we're gonna and what you're noticing, we're gonna make the adjustments and recommendations of frequency of treatment and how much and when and where.
Yeah.
So we always start people off with IVs. We have injection as an option. Once you've done ketamine, we know how it how you react to it physically, how it works in your body, then we can talk about options. So injections, my PTSD patients tend to gravitate towards injections. Needle phobia, obviously they don't want an IV. But that being said, I have a team that is amazing for needle phobia. I've gotten people through that will not let anybody poke you, especially Brittany. She's amazing, but my other two are great as well. So we definitely work with a lot of people with needle phobia and get them through that. And that in itself, it's another phobia. Now they're not phobic of it, and if they need medical interventions, they can,
Yeah.
So
Right.
we always start you off with an IV. After that, it's up to you, depending on what works for you. But if you're treating pain, it needs to be IV. I've only had one person in thousands that injection was better for them for pain. In general, it's IV is going to be. And if you want to have a pain focused conversation, it's a little bit different in how we do it. Usually do higher doses over a much longer period of time to just calm all those nerves down.
Right.
But we're always going to just start you off and see how you respond to just the regular way. And then we also have options if you are referred to by your therapist to us, and your therapist is going to be doing ketamine assisted psychotherapy with you. We still prefer that you do at least one IV and that you do it in office so that we know how you respond to it. IV is where the research is at. You're getting 97% or more of the medication, high absorbability, high useful. That's where the research is at that really backs it up. For patients that have only done nasal spray or troches in a therapy setting, when they actually do an IV, it is night and day. Based on what the patients report, that it is like not comparable. If an IV is a 10 out of 10, a nasal spray or a troche is going to be like a 3 or 4 out of 10. That being said, that has its place. If you're working with your therapist, being in a space where you can still talk and be upright and interact is very, very useful. So it doesn't make it less than, but I think if you're seeking treatment for depression and that's the only thing that you're doing, and it's not for ketamine assisted psychotherapy, doing IV treatments beforehand, you're going to get so much more benefit out of it than just doing the nasal spray or the troche. Troche, fancy name for a tablet that dissolves under your tongue. Nasal spray, self-explanatory. The part that's not self-explanatory in saying those words is these are compounded medications, as they go to a specific type of pharmacy that compounds a medication, and then you get it. You get that medication from the pharmacy. There is a ketamine nasal spray out there called Spravato. It's actually S-ketamine. It's half of racemic ketamine. So the ketamine we've been talking about is racemic ketamine or whole ketamine. S-ketamine is a part of that taken away and created into its own drug. Much less effective, less dissociative, which isn't a bad thing, and super, super expensive, but it is covered by your insurance as long as you meet all the criteria and you've met your deductible. This is the part that people don't understand. Most people have like a $5,000 deductible. When you do Spravato or S-ketamine through your psychiatrist that's covered by insurance, it's $1,000 a treatment.
Yeah.
Our treatments are $250 a treatment.
Yeah.
So just things to consider when you're looking at insurance versus not. If you have a $250 deductible, yeah, go do Spravato. If you have an 80-20 deductible on medications, so 20% of that's going to be $200, right?
Yeah, right.
So these are things to consider when you start talking about, does insurance cover that?
Yeah.
And whether or not you've met your deductible. So
and you have to show that you have tried certain types of
and that you qualify for that medication. Yeah, and currently it only qualifies for treatment-resistant depression.
Right, and that you have tried other forms of treatment.
You have to. So it's those hoops aren't too bad. You do have to be under the care of a psychiatrist. You have to stay at the psychiatrist's office for 2 hours. You have medical monitoring. You have to show that you have been diagnosed with treatment-resistant depression and that you have tried at least 2 medications at their therapeutic amount, which usually means not max out dose, but pretty high therapeutic dose for 6 months, and that you tried at least 2 medications. So for a lot of people, they do have that treatment-resistant diagnosis. They just have to, go through the prior authorization and all of that.
Right.
My understanding is like it's $20 a treatment with Medicaid. So, certainly for Medicaid patients to do Spravato, if they're under the care of a psychiatrist, and, but that's not going to include ketamine assisted psychotherapy, obviously. It's not going to, doesn't, but I think it has its place for sure.
Yeah.
Side tangent. Anyway, Spravato or esketamine nasal spray that's covered by insurance is not the same thing as the compounded ketamine nasal spray that I prescribe. Compounded ketamine nasal spray, the prescription cost that you're going to pay at the pharmacy is probably $45 to $65 for a month's supply. So like 4 to 8 treatments.
Yeah.
Um,
Much more. Yeah.
it's, you know,
I really appreciate you sharing some of those cost, like this is access, right? Who has access? How can they get access, and understanding the different things. Now you practice here in Utah, of course, our listeners could be anywhere in the world.
I'm also licensed in Idaho, and I'm working on Arizona.
Okay. Okay, good to know. So we've run out of our wonderful time. You've shared so much. So no, you're great. This is great. It's your time. I'm like, goodness.
I know, it's a huge topic to cover.
Give everybody, what's the name of your clinic? How do they find you? What's, this is your chance to kind of get yourself out there, and if you're interested in meeting with Rita, this is where they can find Rita and her team.
Yeah, so it's Restorative Halth Primary Care and Ketamine Clinic. It's a mouthful. As we built this practice, we just kind of added on. I did start off as primary care. So we do, in addition to ketamine, we do primary care, whether you have insurance or not. We don't take insurance. We're not credentialed with insurance, but all of our costs we are upfront with everything. Our prices are all posted on our website. If you call us and say, I want to do this, how much is it going to cost? We're going to tell you what it is, and there's not going to be any surprises. And for a lot of people, it's less than what they would pay, especially if they have a high deductible. So we do have a lot of people with insurance that see us. The medications are still covered by insurance, but the visit, but we also take HSA and FSA cards as well. So if you have a health savings account, you can use it for that. This is the part that I don't do, but I'm pretty sure it's just the www.restorativehealthprimarycare.com. But if you just Google, ketamine in Sandy or Restorative Health Sandy, because we are located in Sandy, Utah, will also come up. I don't know how to share a link with you, or can you share that? I
will share. Yes, I will share a link to your website.
Yeah, I know we have some scan codes, but there's different ways to get a hold of us. We are very text friendly, so if you're kind of in crisis or not wanting to talk to anybody, or you're looking at this at 2 a.m. and you just want to reach out, just text us. Your name and that you're whatever kind of treatment you're interested in. So we do primary care, we do hormones, we do weight loss with like Ozempic, tirzepatide, those medications. And we also do medical cannabis, which from a therapy side of things, PTSD is a qualifying condition. You just need a letter from your therapist. So those are kind of a broad spectrum things that we do. But you can, on our website, there's also links to become a patient. You can just fill out our new patient form. As soon as we get our new patient form and somebody's awake, we'll reach out to you. You can request a consult and just put your phone number and what you want. There's several ways of getting a hold of us. Text is probably the most expedient way, especially if you say, I'm interested in ketamine treatments, or I'm interested in medical cannabis, and then we know kind of where to take the conversation. And you can text and say, I'd prefer a phone call when you guys are awake, or I would like to just handle all of this via text. We're happy to call you, but we are pretty responsive. We do pride ourselves on our response rate for texts and calls. We do try to get back to you as soon as possible, once everybody's awake and moving around. So usually after 8 a.m., we'll reach out, and I am the owner. All the number goes to my cell phone. If I'm awake and it makes sense, I might respond to you. So I try to be pretty readily available to my patients with any questions or concerns, and certainly with new patients. So that's the best way to get a hold of us. You certainly can drop in. We'll do our best to fit you in. If you're looking for ketamine, we always want to do a consultation first. Rarely do we do treatment same day unless you're in crisis. If that's what's going to work best for you, we really try to work with your schedule and your availability and your needs. So
Wonderful.
Really quick,
Rita,
something I wanted to address really quick with, you brought up LDS culture and psychedelics, and kind of, I have noticed, especially if you are still active LDS, there's concern about ketamine and it being a psychedelic. It is not. It has psychedelic-like aspects to it. It's an anesthesia. It's a prescription. It's legal. It's prescribed under a medical provider with a DEA license. I have noticed that in general with the LDS culture, bishops approve medications that are prescribed by a medical provider. So I've had cannabis cleared through active LDS patients through their bishops because it's a prescribed medication. You're coming in, you're meeting with me, you're getting, a certificate, a card to then go to a pharmacy to pick up your medication like anything else.
Yeah.
Same with ketamine. This is legal. This is, it's a Schedule III drug monitored by the DEA, prescribed by a medical provider with a DEA license. So for people that are fearful or unsure or feel like they might be separating too far from some of their belief systems, that seems to be reassuring for people that fear, I don't know, their soul or their bishop's approval. I don't want to make light of it, but
that are concerned about following the word of wisdom, or they're concerned about whether or not
you're not coming here to get high.
Right.
It's legal. It's prescribed. It's supervised. It's monitored. It's safe.
And I have seen quite a few Latter-day Saints talk about this, like on podcasts and other, I don't know, blogs or things where they are being open, like, hey, this has been really a helpful treatment, and it was supported, by their ecclesiastical member and things of that nature. So I appreciate you saying that, and I think it's important for anyone who's interested in at least things that can be medically helpful. That's as a
I have a lot of people like, I would love to, but I can't do anything illegal. I'm like, neither can I.
Yeah, neither can I.
So anyway.
Thank you, Rita. Rita's at Restorative Halth. So if you're interested in anything she's talking about, by all means, reach out to her. We also are doing ketamine assisted services at Symmetry Counseling. So reach out to us as well. We're going to be collaborating, I think, with Restorative Halth for years to come. So I think that will be a lovely relationship. And thank you again so much for your time, your expertise, the way you explain things. It was just really lovely. So thank you again, and hope you have
a fun. I'm so anxious about it. So.
Oh, I love it. It was wonderful. So have a great rest of your week.
Okay.
We'll take care. Bye-bye.
Bye.
Thank you for listening to the Natasha Halfer podcast. To help keep this podcast going, please consider donating at natashahalfer.com and share this episode. To watch the video of this podcast, you can subscribe to Natasha's channel on YouTube and follow her professional page at Natasha Halfer, LCMFT, CST-S. You can find all her cool resources at natashahalfer.com. The views, thoughts, and opinions expressed by our guests are their own and do not necessarily reflect the views or feelings of Natasha Halfer or the Natasha Halfer podcast. We provide a platform for open and diverse discussions, and it is important to recognize that different perspectives may be shared. We encourage our listeners to engage in critical thinking and form their own opinions. The intro and outro music for these episodes are by Otter Creek. Thank you for listening.
There is a place where time slows to nature's pace, and there is space there to find yourself in her embrace. Some places should be left alone. Now tishki say the Navajo, so we can always go to the homeland of the heart. pages of our human history etched on her canyon walls, alongside Earth's mysteries. Some places should be left alone. Nahotishki so we can always go to the homeland of the heart, to the homeland of the heart. In our cities, we sleep without her stars, yet still her presence sustains us from afar. Some places should